This is my standard post-op spiel for post-op tonsillectomy patients and what to expect for post-operative recovery. The first thing that I tell parents is diet, because everyone is wondering what they can eat. There's actually no significant differences that have been reported in terms of post-operative outcomes or bleeding with changes in diet. But in general, I tell patients to expect to want to eat softer foods for the next 1 to 2 weeks. And in general, to try to avoid hard, scratchy, pokey type of foods. My general rule of thumb is if you can take a piece of food and draw it across your skin and cause a scratch, that maybe that's not an item or a food that you might want to do for the next 2 weeks. But as long as it can pass that scratch test, that's probably an okay thing to eat. So a chicken nugget, pizza, but maybe not the crust. Things like that, all of those things that you can draw across your skin and not cause a scratch are great items to eat. And as long as you're drinking, it's normal to not want to eat as much over the next couple of weeks. So as long as you're drinking and staying hydrated, that's fine. This is not the time to worry about juice. Whatever your child will drink to stay hydrated and to be able to drink is great. I also get asked a lot about straws and if straws are okay. The theoretical risk is that whenever you're increasing that negative pressure on the inside of your mouth, that it could potentially increase the risk of bleeding after surgery. I think that many kids these days, including my own children, tend to prefer using their cups that they use every day, which many of them are straw cups. And so I think it's more important that if that is the only thing that your kid will drink out of, I think it's more important to continue to use that than for them to try all of a sudden to use an open cup again. Now is not the time to try new things. So that's what I recommend for a post-operative diet.